A milestone. We'll wrap up our course in microbiology using our Introduction to Microbiology textbook by Tortora. Today we'll be looking at Chapter 26, Microbial Diseases of the Urinary and Reproductive Systems. There's our kickoff micrograph of some leptospirosis causing bacteria. They are spirochetes with a super tight kind of a spiral compared to Borrelia and Treponema. All right, so quick little look at the anatomy. Urinary system, obviously two kidneys, two ureters, which are the tubes that carry the urine from the kidneys down to the urinary bladder, single bladder, and then one urethra, which is the outlet passageway from the bladder to the outside. Infection is typically prevented by valves so that the urine can't flow back towards the kidneys, and that kind of forms a wall. The pH of the urine is usually a little on the acidic side. Ideally, if we can even manage that by dietary administration, we can eat foods that help promote acidic urine, which suppresses bacterial growth. And the mechanical flushing, that means that every time you urinate, the urine blasts bacteria out of the opening to the urethra, which there's always bacteria on the surface of your body trying to colonize your urethra. There's a little diagram. We can see all the components we just mentioned. The female urethra is very short compared to the male, and so it's much more likely for bacteria to manage to colonize the urethra and then even get into the bladder and cause bladder infections. The female reproductive system, there are two ovaries, as I'm sure you know, two uterine or fallopian tubes that connect the uterus to the ovaries. They collect the eggs, and then they travel through the fallopian tubes to the uterus. The cervix is part of the uterus that connects it to the vagina, and the vagina connects to the outside. The vulva includes the external genitals, the labia major and minor. And there's a little cartoon drawing of very familiar cartoon drawing of the various parts we're talking about. You can see the urinary system components and the reproductive system components there. The genitalia. There's another picture showing the cervix, the vagina, the uterus proper, fallopian tubes, and ovaries. Male reproductive system, two testes. System of ducts, the epididymis is where the sperm form or are stored actually, and then they travel through the vas deferens or ductus deferens down through to the urethra, and then the ejaculatory duct to the urethra, and then on out. There's a number of accessory glands, a couple of accessory glands, and the penis. The penis is the organ that through which the urethra passes on its way out. There's a familiar diagram of all those parts. External genitalia, and there's a prostate gland. You can see the seminal vesicle, another secretory gland, and the ductus deferens, and so forth. And there's the passageway to the urethra for the sperm and urine, common pathway. All right. Normal urine is not sterile because as it passes out, it's again blasting bacteria out of the urethra or out of the labia as well, shucking bacteria off into the outside world. The prominent microbes in the vagina are lactobacillus. Lactobacillus produces hydrogen peroxide as well as an acidic environment. The stratified squamous epithelium of the vagina has a significant amount of glycogen in it, with the synthesis of which is spurred on by estrogen, and the lactobacilli ferment that glycogen. That's what they eat, that's what they live on, and they produce lactic acid, which keeps the pH of the vagina acidic and suppresses the growth of other microbes. That's kind of nice. Other bacteria that can be present, streptococci and some gram-negative bacteria, some anaerobes can be in there. They don't get to overgrow though because it's too harsh of an environment for them. Candida albicans, yeast, they're in your oral cavity, they're in the they're in the vagina, they're all around on your body. You're in lots and lots and lots of it in your intestines. They're just common. They're not even a pathogen. They're just very commonly present. Male urethra, um, it does introduce some bacteria, can introduce some bacteria into the semen. Propionibacterium, Corynebacterium, and Pseudomonas can be present in the seminal vesicles. There's a little picture of a study of urine microbiota. Infections, what do we call the names for the various stages of infection of the urinary system? Urethritis, if bacteria get into the urethra and cause inflammation, it'll be painful upon urination. If the bladder itself becomes infected with bacteria, that's called cystitis. Then from there, if the infection progresses, you'll have ureteritis, the ureters become infected. And finally, pyelonephritis is an infection of the kidneys themselves. So it's a very serious condition indeed. It can be life-threatening. Very common problem in this country or throughout the world. The most common pathogen or agent causing urinary tract infections is E. coli, coming from the digestive tract, coming from the anus. So cystitis, mostly caused by E. coli, occasionally Staph saprophyticus. So dysuria, pain on urination. It's much more common in women, of course, as we mentioned, the short urethra makes it much easier for the bacteria to colonize it, even into the bladder, and cause infections. The diagnosis is 1,000 or more colony-forming units of bacteria of a single species, plus a positive leukocyte test or leukoesterase test. If you do a clinic dipstick test of urine, it'll have right on there. One of the things they'll test for is leukocytes, which they're looking at. Actually, in that case, they're probably looking at nitrites. This is leukocyte esterase. But anyway, the sign of the presence of white blood cells indicates an infection going on. Treatment is with nitrofurantoin. There's growing resistance. Even relatively recently, the standard of care was trimethoprim and sulfamethoxazole, and now it's gone. Those aren't the first line treatments at all because of the high frequency of resistance of E. coli to those things. So pyelonephritis, infection of the kidneys, 75% caused by E. coli, causes fever and back or flank pain, eventually causes bacteremia, again a very serious condition where bacteria are in the blood. It can cause permanent damage to the kidneys and be life-threatening. You have to have your kidneys working. It's life and death if your kidneys aren't working. Diagnosis, over 100,000 colony-forming units of a single species of bacteria in a clean catch urine sample, and also that leukocyte esterase test showing that there's white blood cells in large numbers present. Treatment is with cephalosporin. So that's the UTIs in a nutshell. Leptospirosis is another disease of the kidney infection. Leptospira interrogans is a very tightly coiled spirochete bacterium, and is transmitted from urine of animals. So if you get exposed to urine of animals, dogs, all kinds of farm animals and so forth, wild animals, if you get the water, you're gonna have a possibility of getting leptospira. So we've already learned to stay away from water sources that aren't municipally treated and chlorinated and so forth and purified. You might get giardia, while you also might get leptospirosis, which would be unfortunate. These bacteria get into your kidneys and cause damage, cause kidney failure, pulmonary hemorrhagic syndrome, very serious stuff. Treatment with doxycycline. Diagnosis with a rapid serological test, antibody test. So a 20-year-old woman feels a stinging sensation when urinating, feels an urgent need to urinate even if very little is excreted. Lactose fermenting gram-negative rods are cultured from urine. What is the likely cause? And you may remember E. coli are lactose forming, and then they're gram-negative bacilli. And since E. coli is by far the most common cause of UTIs, that would be a good guess for this one. There's a picture of probably McConkey agar with E. coli growing on there that are fermenting the lactose. All right, diseases of the reproductive system. Sexually transmitted diseases are now called sexually transmitted infections. So whereas STDs, you do a search and it would all be all about STDs, now it's all about STIs. The times they are changing, right? Often no signs or symptoms, which is bad because oftentimes transmission to many sexual partners can occur before someone knows that they're infected. Hopefully, the more monogamous people, the less that's going to happen, but that doesn't seem to be prevalent anymore. We'll talk about a number of different types of infections. I don't think we're going to hit 30 infections, but there are 30 or more possibilities. 20 million new cases annually in the United States in young people. Interestingly, protected sex is all you have to do in order to greatly limit the chances of having an STI. There are home test kits, and they can be very fast and relatively affordable. And so that's something that is technology has brought us, because it's oftentimes maybe people don't have any symptoms, they don't want to test, but now if you can have access to a very easy to use, affordable, quick test, maybe you think, well, I had a new sexual partner, I don't know that person very well, maybe I'll do a check, do a test. Or maybe you do have some symptoms, you're like, what's wrong with me? Is it an STI? So it's really good to have these things available. And some of them you send away the sample to a clinic for professional testing. Some of them are right on the spot tests, urine test, dipstick test, for example, or a quick test. There's just a picture of one particular example of a quick test, a home test. So the pros of home quick testing, as I was mentioning, catch more cases, easier for patients, less shame of going into the clinic and saying, I'm afraid I have had sex with somebody that wasn't careful or something like that. Quicker treatment, prevent chronic conditions. Sometimes they're a little expensive, maybe 40 bucks for a test, and a lot of UTIs or STIs, I meant to say, are happening in less I don't know, wealthy parts of the society. So 40 bucks might not sound like much, but it may be an absolute barrier sometimes. So privacy concerns, what if you send it off and it becomes basically public information that you sent in a test kit, or if someone sees you buying it or whatever. Not all the test kits are super accurate, so there could be concerns about accuracy. So you might get a false positive. If that happens, you might try a different kit, or even going to see your primary care or your urologist or your gynecologist. Positive or a quick HIV test. So there's a HIV test based on saliva, and it works. It looks a lot like the way a pregnancy test would look, or a COVID test. If there's a positive antibody, you'll find this extra band popping up. All right. Gonorrhea. Incidence in the United States in 2016, 130 cases per 100,000 people. That's pretty significant. It's a very common STI. Neisseria gonorrhea. Gram-negative diplococcus. We've already encountered Neisseria meningitidis, so we're familiar with that kind of arrangement of cells in that gram reaction. Fimbria. They have fimbria that attach them to epithelial cells of epithelial mucosa, either in the oral cavity or pharynx, or in the urinary and genital systems, or in the anus and rectum. These cells can then invade between the epithelial cells and cause inflammation. There will be pus present. There will be a pus discharge um, yellow-green pus discharge. Um, so again, you can get pharyngeal or anal gonorrhea, not just vaginal or penile forms of this disease. And there's just a little graph showing the, so yes, incidence of or prevalence of this disease per 100,000 population over years of time from World War II on up to pretty recently. And things have kind of tapered off. Looks like there was a great big peak in the early mid 70s. Don't know exactly what that's about, or if that's a result of the sort of free love culture of the 1960s, leading to a lot of people with a lot of sexual partners, and guess what? A lot of venereal diseases. There's a distribution map showing the areas of the country where there's the greatest incidence, but if you look at only about 10 years ago, there were almost all white states over here, so this is a disease that's becoming more prevalent all over the country. So symptoms of gonorrhea: men painful urination and discharge of pus, epididymitis. That epididymis, that it's a coily kind of set of tubes where the sperm are stored before they're um, sent out for ejaculation. Women, fewer symptoms, oftentimes asymptomatic, but it can lead to pelvic inflammatory disease. So the infection gets into the cervix, uterus, and even fallopian tubes, and that can cause discomfort in the pelvic region and also damage. If left untreated, it can eventually become systemic and cause endocarditis. We talked about infections on the lining of the heart and the heart valves, meningitis, right? We talked about, again, Neisseria meningitidis. Now we're those bad little gonorrhea. Neisseria bacteria can also cause meningitis and arthritis. Ophthalmia neonatorum during childbirth, as the baby passes through the birth canal, it can get infected in the eyes, and that can cause blindness. And other infections. So, as we've probably mentioned before, at birth in this country, as much as possible, all babies are immediately treated as soon as they come out of the birth canal with antibiotic eye drops to prevent that from happening. There's a picture of a little bit of pus discharge from the penis. All right, so one thing about gonorrhea is these bacteria have OPA proteins, which inhibit helper T cells from becoming activated. So there's not good immunity against the bacteria. It's partly how they can cause all those systemic diseases and so forth. So they have this pretty terrible virulence factor or capability. Diagnosis with gram staining the bacteria and seeing the diplococci with gram-negative stain. ELISA, very specific immunological test. Using monoclonal antibodies. Treatment with ceftriaxone or azithromycin. The bacteria are getting more and more resistant to traditional antibiotics that have been used. Here's a little micrograph of stained Neisseria gonorrhea. You can see neutrophils. Those are leukocytes there, and they've gobbled up a whole bunch of Neisseria bacteria that you can see in their cytosol. You can see the diplococci, and they're gram-negative. So here's the resistance picture. So we're out here in the right-hand side of the graph, obviously, and moving forward even farther. But so far, azithromycin and ceftriaxone are good choices for treating gonorrhea because of the susceptibility, whereas tetracycline and fluoroquinolones like Cipro and penicillin are not very effective anymore. One interesting thing, look at the resistance to azithromycin in 2005 survey, and now look in 2016. So discontinuing using that antibiotic and switching to other antibiotics then got rid of a lot of those resistant antibiotics, and now we're in a situation where that's a useful antibiotic once again. Non-gonococcal urethritis. What other organisms can get in there and cause inflammation of the urethra? Chlamydia trachomatis, by far the most common. Also mycoplasma infections and ureaplasma, ureolyticum. Those are other microorganisms that can cause it, but by far chlamydia, it's super common STI. Causes painful urination and a watery discharge instead of a pus discharge like with gonorrhea. It's a watery discharge. Often asymptomatic, unfortunately, leads to a lot of transmission of disease through sexual activity. Causes pelvic inflammatory disease in women, getting all into the whole reproductive tract. Diagnosis with nucleic acid amplification tests. The one that we're most familiar with that we've talked about is RT-PCR, very specific and very fast and cost effective, but there's about 5 more newer types of nucleic acid amplification tests that are available. But just so you know, you don't need to worry about the details of those. Treatment with azithromycin and doxycycline for chlamydia. Doxycycline can get up into the cells, go in after the microbes. Remember, chlamydia has that strange life cycle where they have the intracellular form versus the infective extracellular form of the bacteria. All right, pelvic inflammatory disease. Now we've got uterus, fallopian tubes potentially involved. Usually it's a co-infection with Neisseria gonorrhea and chlamydia trachomatis. Those two things together almost universally are causing pelvic inflammatory disease. Causes chronic abdominal pain. Salpingitis is what it's called when the infection gets into the fallopian tubes, and that's a very serious condition that's basically almost as bad as it can get, right? It's moved all the way up through the entire reproductive tract. Scarring in the fallopian tubes can cause infertility, and that's a bad outcome, obviously. And ectopic pregnancies, if some scarring blocks the movement of the egg far enough, and then the sperm can get through a scarred area, then that can cause implantation in the fallopian tubes, and that can be life-threatening when a pregnancy occurs in that location. Treatment with doxycycline and cefotetin, a beta-lactam, a modern beta-lactam bacteria that's a little more resistant to, well, not resistant, it's useful against resistance strains of the microorganism. That just shows inflammation of the fallopian tube and the fimbria on one side, particularly by this advancement of disease in the uterus and then into the fallopian tube. Syphilis. Syphilis is caused by the spirochete Treponema pallidum. We've run into that a bunch of times. Invades the mucosa through skin breaks and enters into the bloodstream. Induces inflammation. Some strains cause yaws, a skin disease that's not sexually transmitted, but generally speaking, we're talking about a sexually transmitted disease. Increasing number of cases lately. There's a picture of some treponema, corkscrew-like spirochetes. And we can see that a real drop in the prevalence of this disease, and now it's rising again for some reason over the last 10 years up to 2016 and continuing to today. There's a rising incidence or prevalence of syphilis. You can see the distribution in the country. Not enough of an epidemiologist to know why that is. Why are those regions the highest in terms of prevalence? There's multiple stages of progress of a syphilis infection. The first step is maybe flu-like conditions, fever and rash. Not always. Some people are asymptomatic at that point. Chancre is like a hard, round sore on the genitalia. Highly infectious at that stage, though. So, scope out your body, scope out your sex partner's body before you jump in. Secondary stage, after that, after a few weeks, those symptoms disappear, and then skin and mucosal rashes, especially on the palms and soles, due to an inflammatory response. And then there's a latent period that can be for a very long time, years of time. And then the tertiary stage, gummas, which are tumor-like growths on the skin and on internal organs can occur, and due to some cell-mediated immune reactions and it's very, very destructive. It can cause psychosis, called neurosyphilis, dementia, all kinds of problems. So congenital syphilis, if it's occurred, it can get to the fetus and damage the fetus. So it crosses the placenta. So a very terrible disease indeed, a fatal disease ultimately, but going a bad way on the way out. There's a picture of a chancre on the penis. There's a picture of the secondary stage with a rash on the palms. And there are some gummas on the skin. But again, those gummas can form on all internal organs. Any internal organ, for the most part, can be infected by these spirochetes. It's a systemic disease. Syphilis direct fluorescent antibody test. We looked at way back, and that's still a commonly used test. There are a couple of serological tests which are interesting. They use a mixture of cardiolipin, lecithin, and a couple of other cholesterol, and for some reason they will agglutinate antibodies against treponema. And so there's a couple of these tests, these rapid plasma reagent test and the VDRL test. It's a slide-based agglutination test. They're cheap and fast, but they do produce a fair number of false positives because it's not really a true spirochete antigen. It's a non-specific antigen. There are treponema type serological tests where you're actually testing with antibodies or with antigens, so enzyme immunoassays, and so forth. So treatment with benzathine penicillin. It's an interesting chemically modified penicillin in which it's a combination of substances that are produced by a certain benzene ring adding modification, and what it does is causes a slow, steady release of penicillin. So it's like having a long-term release of penicillin G into the blood to help kill these slow-growing bacteria off. Lymphogranuloma venereum, LGV. That's caused by Chlamydia trachomatis, and it infects lymphoid tissue. So the lymph nodes in the region become enlarged and tender, and it can cause a discharge of pus and cause scarring. So there's diagnosis with blood tests for antibodies against these Clostridium. Chlamydia trachomatis, and diagnosis with also ELISA's amplification test, nucleic acid amplification test, and treatment with doxycycline. So yet another chlamydia problem, getting into the immune tissue. Here's another type of STI. It's called chancre or chancroid, soft chancre. It's the chancre sore, the painless chancre produced by the spirochetes of Treponema pallidum is like a hard round chancre, and this is a soft chancre. So that's the one way you can distinguish chancroid from syphilis. So painful ulcers on the genitals, swollen lymph nodes in the groin. So a treatment with azithromycin or ceftriaxone, just a different microorganism, Haemophilus ducreyi. It's a strange looking word for the English. All right, bacterial vaginosis. There's vaginosis, which means non-inflammatory vaginal infection, and there's vaginitis, which means inflammatory vaginal infection. So now we're talking about vaginosis, the non-inflammatory type, Gardnerella vaginalis. It's a gram-negative bacteria, and it causes a fishy smelling, copious, meaning a lot, frothy discharge from the vagina. When you take a sample for testing, you'll see a lot of squamous epithelial cells, which you'll see in any case because they're always being shed from the vaginal epithelium. You'll also see lots and lots of bacteria all in them, which you normally wouldn't see. Those are called clue cells because they tip off that there's bacterial infection there, causing this vaginosis, causing this unsavory discharge. Treatment with metronidazole. And there's a picture of an epithelial cell. It's got a real small nucleus. These cells tend to have a flat appearance. Sometimes you can even see the edges look kind of curled up, and you can tell they're very flat and thin, which is exactly what squamous cells are. And that little nucleus in there, but now you can see lots of these little granular-looking bacteria, which would not normally be seen in a smear from a normal person, healthy person. Well, it gets to be a healthy person with minor disease. Herpes. We talked about human herpes viruses 1 and 2, or herpes simplex viruses 1 and 2. Genital herpes is typically caused by herpes simplex virus or human herpes virus 2, but it can be caused by herpes simplex virus 1. It's not a cut and dried thing where HSV1 causes cold sores and HSV2 causes genital herpes, although that is generally the division. Painful vesicles, little blisters, clusters of blisters that form on the genitals, causes painful urination. They healed up within a couple of weeks. The thing about it is, as you remember from human herpes viruses, they exhibit latency, so at any time there can be a flare-up, brand new lesions produced by these viruses. Different things can cause it. Through period, emotional stress, or a weakened immune system through illness can cause a resurgence of the active herpes viruses. You can be infectious. You can cause transmission of the disease whether you're in the infectious state with lesions or not. There's no cure. Acyclovir is used to combat the viruses when there's a flare-up. There's a couple of variations on acyclovir that help. Those are antiviral drugs, as you know. And you can see what's happening to the number of doctor's visits for genital herpes, going up and up and up steadily, pretty much. I mean, it's kind of noisy, but it's a general upward trend since the 1960s. Not sure exactly why that is. Here you can see some of that, just a cartoon drawing of the little blister lesions of herpes, genital herpes, in their general location. There's an actual photograph of some of the lesions on the penis. Neonatal herpes. Herpes, again, also crosses the placental barrier and causes CNS damage, developmental delays, blindness, hearing loss, very, very severe. Survival rate of 40% in fetus if there's transmission. Newborns can also be infected during childbirth. So especially if there's some a flare-up and some lesions are present, they're very infectious. Lots of virus particles there can cause infection there. Diagnosed by PCR tests and fluorescent antibody tests. Treatment with acyclovir, as we've already noted. Genital warts. Now, there's another virus that causes problems, and that is human papilloma viruses instead of human herpes viruses. And papilloma viruses have about 35 or 40 different serotypes or types, and they're different ones cause different diseases. And for example, human papilloma virus HPV 6 and 11 tend to cause warts on the surface of the skin, whereas HPV 16 and 18 are the most notorious ones associated with cervical cancer. And hence they have the HPV, the multivalent HPV vaccines to prevent human papillomavirus infections and cervical cancer. There's a picture of some genital warts. They can be removed surgically. You can treat with imiquimod, a way to increase the secretion of gamma interferon to help the immune system fight against the virus as well. Candidiasis. Candida albicans is again a normal inhabitant of the body in virtually every place in all the external quote unquote organ systems, urinary system, and definitely the digestive system, nasal cavity, oral cavity, and reproductive system. But if they get out of balance, if they're allowed to overgrow, then you can have problems with it. So how do you get overgrowth of Candida albicans? Antibiotic use. Um, the bacteria that are keeping them at bay, such as lactobacillus, can be killed off by antibodies and or different compartments of the body, oral cavity as well, and that allows the yeast to grow, and they start causing inflammation. Diabetes, certain hormones. So if you get an overgrowth, alcoholism, I should mention, if you get overgrowth of candida in the oral cavity, it's called thrush. You can see like a whitish material all over the tongue and gums. Vulvovaginal candidiasis, vaginitis is that inflammatory infection of the vagina. In this case, you have painful or itchy inflammation, and also a yeasty, thick, or cheesy yellow discharge. Treatment with clotrimazole or fluconazole, some good solid anti-mycotic drugs. Get those yeast back under control. Trying to think, miconazole has traditionally been a over-the-counter treatment for yeast infections in the vagina. Miconazole, so-called. Oh, I forgot the name of the product. Anyway, I'm sure you've heard of it. But anyway, protozoan diseases, Trichomonas vaginalis, and Trichomonas vaginalis are pretty common in normal, healthy women, but again, they can get out of balance, and when the acidity is lost in the vagina for whatever reason, whether antibiotic use or maybe douching too much and rinsing out the bacteria too much, then that allows the pH to rise in the vagina, and then that can allow overgrowth of trichomonas. And trichomonas, right? Remember we said that vaginosis is associated with a kind of a fishy smelling profuse discharge. Now we have a foul smelling, frothy, greenish yellow discharge. So that's how you can tell apart vaginosis from trichomoniasis, Trichomonas vaginalis. Diagnosis with microscopic identification of these protozoa or a DNA probe to light them up. Treatment with metronidazole, anti-protozoan drug that we've encountered several times already. There's a little micrograph of those protozoa. How lovely to have them swimming around in there. A 26-year-old woman has abdominal pain, painful urination, and fever. Cultures grown in a high CO2 environment revealed gram-negative diplococci. What could be gram-negative diplococci that can cause STIs? Neisseria, gonorrhea, right? We've encountered them, and encountered those Neisseria diplococci before, and so it's a tip-off. Super common, second only to chlamydia trachomatis in terms of frequency of infections causing sexually transmitted infections. And there's our little summary tables, which are so helpful for keeping track of all the things we've learned. So that's the end of our whole textbook. So what a ride, and what a lot of interesting things to learn, and what a lot of things to learn. So I appreciate that. You have your work cut out for you, and I wish you well in getting it all wrapped up. And please keep in touch with me if you need any help with anything.